Good morning, everyone, and welcome to our lecture on research designs and statistical analyses, tailored to understanding qualitative and quantitative research methods in the context of academic and applied settings in Canada. Today, we will explore the foundational principles of designing robust research studies and applying statistical analyses to derive meaningful insights. Research designs provide the blueprint for investigating phenomena, whether exploring human behavior through qualitative interviews or testing hypotheses with quantitative experiments. In Canada's diverse research landscape, from health sciences to social studies, these methods are critical for generating reliable, actionable knowledge. This lecture will cover key concepts, such as sampling techniques and statistical tools, their real-life applications, like in clinical trials or sociological studies, and best practices for ensuring validity and ethical integrity. We'll examine qualitative methods, like thematic analysis, and quantitative approaches, like regression modeling, alongside examples of research designs, such as case studies or randomized controlled trials. The course objectives include equipping you with skills to design rigorous studies, analyze data effectively, and apply findings ethically in real-world contexts. Ethical considerations, such as informed consent and transparent reporting, are central to maintaining research credibility. By mastering these principles, you'll contribute to evidence-based solutions that address Canada's societal and scientific challenges. We begin with the lecture outline, providing a roadmap for our exploration. Following our introduction, let's review the lecture outline to guide our exploration of research designs and statistical analyses. This lecture is structured to provide a comprehensive understanding, starting with an introduction to research designs and methods, defining their roles in scientific inquiry. We'll explore key concepts in qualitative research, like interpretive frameworks, and quantitative research, like statistical significance, followed by sampling techniques, such as random or purposive sampling. Statistical analyses, including t-tests and thematic coding, will be covered to ensure robust data interpretation. Real-life applications will demonstrate how these methods apply to fields like healthcare or education, with examples like ethnographic studies or clinical trials. Best practices, such as ensuring reliability and validity, and recommendations, like using mixed methods, will foster rigorous research. A summary will consolidate key takeaways, preparing you to design and analyze studies effectively. This outline aligns with course objectives to develop skills for conducting ethical, impactful research in Canada's academic and applied contexts. Ethical considerations, like protecting participant rights, remain central to credible research. This slide transitions to the introduction, where we'll define research designs and their importance in structuring scientific inquiry. Building on our lecture outline, let's introduce research designs and statistical analyses in the context of academic and applied research in Canada. Research designs are structured plans that guide data collection and analysis to answer research questions, ensuring valid, reliable results. For example, a Canadian health study might use a randomized controlled trial to test a new therapy's efficacy. Qualitative methods, like interviews, explore subjective experiences, while quantitative methods, like surveys, measure numerical trends. Combining these approaches, such as in mixed method studies, provides a holistic understanding of complex issues, like mental health trends in Canadian youth. Ethical research practices, including informed consent and confidentiality, protect participants and enhance credibility. In Canada's research ecosystem, from universities to public health agencies, well-designed studies drive evidence-based policy and practice. This introduction aligns with course objectives to equip you with skills to design rigorous studies that address societal challenges, such as improving healthcare access. By understanding research designs, you'll create studies that yield actionable insights while upholding ethical standards. This slide transitions to defining research designs, where we'll clarify their scope and components. Following our introduction, let's define research designs in the context of academic and applied research in Canada. A research design is a systematic plan that outlines how data will be collected, analyzed, and interpreted to address research questions or hypotheses. For instance, a Canadian sociologist might design a case study to explore community resilience post-disaster. The design ensures validity, meaning the study measures what it intends, and reliability, ensuring consistent results across repeated measures. Qualitative designs, like phenomenology, focus on understanding lived experiences, while quantitative designs, like experiments, test causal relationships. Mixed methods designs integrate both for comprehensive insights, such as combining surveys and focus groups to study Canadian workplace wellness. Supporting diverse research objectives, designs vary by field. Health sciences may use clinical trials, while education research may use longitudinal studies. Ethical considerations include transparent methodology and participant protection, ensuring trust in findings. This definition aligns with course objectives by providing a foundation for designing studies that generate credible, impactful results in Canada's research landscape. By mastering research designs, you'll address complex questions with precision and integrity. This slide transitions to defining qualitative research, where we'll explore its principles and applications. Following research designs, let's define qualitative research in the context of Canada's academic and applied studies. Qualitative research explores subjective experiences, meanings, and social phenomena through non-numerical data, aiming to understand contexts and perspectives. For example, a Canadian researcher might use interviews to study Indigenous perspectives on healthcare access. Methods like observations, focus groups, or document analysis allow researchers to capture rich, detailed insights, such as observing classroom dynamics in Canadian schools. Emphasizing interpretive and contextual analysis, qualitative research employs techniques like thematic coding to identify patterns, such as themes of trust and patient-provider relationships. This approach is ideal for exploring complex, nuanced issues, like cultural influences on mental health stigma. Ethical considerations include ensuring participant confidentiality, informed consent, and respectful representation of diverse voices, particularly for marginalized groups in Canada. Qualitative research aligns with course objectives by equipping you to investigate human experiences rigorously, contributing to fields like sociology or public health. By mastering qualitative methods, you'll uncover deep insights that inform policy and practice, enhancing community well-being. This slide transitions to defining quantitative research, where we'll explore numerical approaches. Following qualitative research, let's define quantitative research in the context of Canada's academic and applied studies. Quantitative research measures numerical data to identify patterns, test hypotheses, or predict outcomes, emphasizing objectivity and generalizability. For example, a Canadian public health study might use surveys to quantify smoking rates among youth. Methods like experiments, such as randomized controlled trials testing drug efficacy, or statistical models, like regression analysis, allow researchers to draw objective conclusions. For instance, a study might analyze hospital data to predict readmission rates. Quantitative research focuses on measurable variables, ensuring findings can generalize to larger populations, such as national health trends. Ethical considerations include transparent reporting of methods, avoiding data manipulation, and ensuring participant anonymity in large data sets. This approach aligns with course objectives by enabling you to design studies that produce reliable, scalable insights for fields like epidemiology or economics in Canada. By mastering quantitative methods, you'll contribute to evidence-based decision-making, addressing societal challenges with precision. This slide transitions to key qualitative research concepts, where we'll explore foundational principles. Building on our definitions, let's explore key qualitative research concepts in Canada's research landscape. Thematic analysis and coding involve identifying patterns in data, such as coding interview transcripts to uncover themes like barriers to healthcare access in rural Canadian communities. Reflexivity requires researchers to reflect on their biases, such as acknowledging personal perspectives that might influence interpretations in a study of immigrant experiences. Contextual and interpretive frameworks emphasize understanding data within its social or cultural context, like analyzing focus group discussions on indigenous wellness within historical frameworks. These concepts ensure qualitative research captures nuance, meaningful insights, such as community attitudes toward mental health programs. Ethical considerations include transparent reporting of researcher positionality, ensuring participant voices are accurately represented, and protecting confidentiality, especially for vulnerable populations in Canada. These concepts align with course objectives by fostering rigorous, ethical qualitative research that informs fields like sociology or education. By applying these principles, you'll generate deep, contextually rich insights that drive impactful solutions in Canada's diverse research environment. This slide transitions to key quantitative research concepts, where we'll explore statistical foundations. Following qualitative concepts, let's explore key quantitative research concepts for Canada's academic and applied studies. Hypothesis testing and statistical significance involve formulating hypotheses, like testing whether a new therapy reduces recovery time, and using p-values to determine if results are statistically meaningful. For example, a Canadian health study might use a t-test to compare treatment outcomes. Variables and measurement scales include defining independent and dependent variables, such as exercise frequency and heart rate, and selecting appropriate scales, like ordinal for survey responses or interval for temperature. Reliability ensures consistent measurements, like repeatable survey results, while validity ensures the study measures intended constructs, such as accurately assessing patient satisfaction. Ethical considerations include avoiding data manipulation, ensuring transparent reporting, and protecting participant anonymity in datasets. These concepts align with course objectives by equipping you to design rigorous quantitative studies that produce reliable, generalizable findings for fields like public health or economics in Canada. By mastering these principles, you'll contribute to evidence-based solutions that address societal challenges with precision and integrity. This slide transitions to sampling techniques, where we'll explore selection methods. Following quantitative concepts, let's discuss sampling techniques in the context of Canada's research landscape. Sampling techniques determine how participants or data points are selected to ensure representative, unbiased results. Random sampling, like selecting hospital patients randomly for a drug trial, minimizes bias and enhances generalizability. Stratified sampling divides populations into subgroups, such as age groups in a Canadian health survey, to ensure proportional representation. Purposive sampling selects participants based on specific criteria, like recruiting Indigenous elders for a qualitative study on traditional healing. Aligning sampling with research objectives ensures studies address questions effectively, such as using cluster sampling for school-based education research. Ethical considerations include ensuring inclusive sampling to represent diverse Canadian populations, obtaining informed consent, and avoiding harm to participants. These techniques align with course objectives by enabling you to design studies that yield valid, representative findings for fields like sociology or epidemiology. By selecting appropriate sampling methods, you'll ensure your research reflects Canada's diverse population and produces credible, impactful results. This slide transitions to random sampling, where we'll explore its applications in detail. Following our sampling overview, let's explore random sampling in Canada's research context. Random sampling involves selecting participants or data points without predetermined criteria, ensuring each has an equal chance of inclusion, like randomly selecting Canadian adults for a national health survey. This method minimizes selection bias, as it avoids favoring specific groups, such as only recruiting urban participants. For example, a study on diabetes prevalence might use random sampling to ensure findings generalized to Canada's population. Enhancing generalizability, random sampling supports quantitative research, like clinical trials, by producing representative data. such as testing vaccine efficacy across diverse demographics. Ethical considerations include ensuring randomization processes are transparent, protecting participant anonymity, and obtaining informed consent to maintain trust. Random sampling aligns with course objectives by fostering rigorous, unbiased study designs that yield reliable findings for fields like public health or economics. By applying random sampling, you'll produce generalizable results that inform evidence-based policies and practices, addressing Canada's societal challenges with precision and integrity. This slide transitions to stratified sampling, where we'll explore targeted representation. Following random sampling, let's discuss stratified sampling in the context of Canada's research landscape. Stratified sampling divides a population into subgroups, or strata, based on characteristics like age, gender, or ethnicity, then randomly samples from each to ensure proportional representation. For example, a Canadian study on mental health might stratify by province to reflect regional differences. This method ensures diverse populations, like Canada's multicultural communities, are adequately represented, avoiding underrepresentation of groups like Indigenous peoples. It's particularly useful for quantitative studies, such as surveys on healthcare access, where proportional representation enhances validity. Ethical considerations include transparent strata selection, ensuring inclusive representation, and protecting participant confidentiality, especially for marginalized groups. Stratified sampling aligns with course objectives by enabling you to design studies that accurately reflect Canada's diverse population, producing reliable, generalizable findings for fields like sociology or epidemiology. By using stratified sampling, you'll address research questions with precision, ensuring equitable representation and impactful results that inform policy and practice in Canada's diverse society. This slide transitions to purposive sampling, where we'll explore selective methods. Following stratified sampling, let's explore purposive sampling in Canada's research context. Purposive sampling involves selecting participants based on specific criteria relevant to the research question, such as recruiting experienced nurses for a study on healthcare delivery in Canadian hospitals. This method focuses on specific perspectives, like interviewing community leaders for insights on social cohesion in urban Canada, making it ideal for qualitative research where depth and context are prioritized. For example, a study on Indigenous cultural practices might purposefully select elders to capture specialized knowledge. Ethical considerations include transparent selection criteria, ensuring informed consent, and respectfully representing participant voices, particularly for sensitive topics. Purposive sampling aligns with course objectives by enabling you to design qualitative studies that uncover rich, targeted insights for fields like anthropology or education. By using purposive sampling, you'll generate nuanced findings that inform community-focused interventions and policies, enhancing understanding of Canada's diverse social landscape while maintaining ethical integrity. This slide transitions to cluster sampling, where we'll explore group selection methods. Following purposive sampling, let's discuss cluster sampling in Canada's research landscape. Cluster sampling involves dividing a population into clusters, such as geographic regions or schools, then randomly selecting clusters for study. For example, a Canadian education study might select schools as clusters to evaluate teaching methods, surveying all students within chosen schools. This method is efficient for large, dispersed populations, like Canada's rural and urban communities, reducing logistical costs compared to individual random sampling. It's commonly used in quantitative research, such as public health surveys assessing vaccination rates across provinces. Ethical considerations include ensuring clusters represent diverse populations, obtaining informed consent from participants, and protecting anonymity in data collection. Cluster sampling aligns with course objectives by enabling you to design efficient, representative studies for fields like epidemiology or education, producing generalizable findings with practical applications. By using cluster sampling, you'll address research questions cost-effectively, ensuring robust data that inform evidence-based policies and interventions in Canada's diverse research environment. This slide transitions to sampling bias, where we'll explore challenges in selection. Following cluster sampling, let's explore sampling bias in Canada's research context. Sampling bias occurs when the selection process systematically excludes or favors certain groups, leading to unrepresentative samples and skewed results. For example, a Canadian health survey relying on online responses might underrepresent rural populations with limited internet access. Ensuring representative samples involves using randomization techniques, like random or stratified sampling, to include diverse groups, such as different age or ethnic demographics. Mitigating bias also includes clear inclusion criteria and pilot testing sampling methods to identify potential exclusions. Ethical considerations include transparent reporting of sampling methods, ensuring equitable representation, and avoiding harm to underrepresented groups by acknowledging limitations. Sampling bias awareness aligns with course objectives by fostering rigorous, ethical study designs that produce valid, generalizable findings for fields like sociology or public health. By mitigating bias, you'll ensure your research reflects Canada's diverse population, generating credible data that inform equitable policies and practices, enhancing societal impact. This slide transitions to qualitative data collection, where we'll explore methods for gathering insights. Following sampling bias, let's discuss qualitative data collection in Canada's research landscape. Qualitative data collection uses methods like interviews, focus groups, and observations to capture rich, contextual data on human experiences. For example, a Canadian study on refugee integration might use semi-structured interviews to explore personal narratives. Focus groups, like discussions with teachers on classroom challenges, provide collective insights, while observations, such as studying community interactions in Canadian parks, capture behaviors in natural settings. Ensuring participant trust and engagement involves building rapport, obtaining informed consent, and maintaining confidentiality, especially for sensitive topics like mental health. Ethical considerations include respectful representation of participant voices, avoiding coercion, and ensuring cultural sensitivity, particularly for Indigenous or marginalized groups. Qualitative data collection aligns with course objectives by enabling you to gather deep, meaningful insights for fields like anthropology or education, informing community-focused interventions. By mastering these methods, you'll uncover nuanced perspectives that enhance understanding of Canada's social fabric, contributing to ethical, impactful research. This slide transitions to quantitative data collection, where we'll explore numerical methods. Following qualitative data collection, let's explore quantitative data collection in Canada's research context. Quantitative data collection uses methods like surveys, experiments, and secondary data analysis to measure variables numerically. For example, a Canadian public health study might use surveys to collect data on exercise habits, ensuring standardized questions for consistency. Experiments, like randomized controlled trials testing a new drug, provide control data on outcomes, such as recovery rates. Secondary data analysis, like using Statistics Canada datasets, allows researchers to study trends, such as employment rates, without new data collection. Ensuring data reliability and validity involves using calibrated instruments, like validated survey scales, and clear protocols to avoid errors. Ethical considerations include participant anonymity, transparent reporting, and avoiding data manipulation to maintain trust. Quantitative data collection aligns with course objectives by enabling you to gather reliable, generalizable data for fields like epidemiology or economics, supporting evidence-based decisions. By mastering these methods, you'll produce robust findings that address Canada's societal challenges with precision and integrity. This slide transitions to qualitative data analysis, where we'll explore interpretive techniques. Following quantitative data collection, let's discuss qualitative data analysis in Canada's research landscape. Qualitative data analysis involves applying techniques like thematic analysis and coding to interpret non-numerical data, such as interview transcripts or focus group discussions. For example, a Canadian study on mental health stigma might code responses to identify themes like social exclusion. Interpreting patterns and narratives involves synthesizing data to uncover insights, such as cultural influences on healthcare access among Canadian immigrants. Ensuring reader-through triangulation means cross-verifying findings with multiple sources, like combining interviews and observations to validate themes in a study of community wellness programs. Ethical considerations include transparent coding processes, respecting participant voices, and avoiding biased interpretations, particularly for sensitive topics. Qualitative data analysis aligns with course objectives by enabling you to derive meaningful, contextually rich insights for fields like sociology or education, informing policy and practice. By mastering these techniques, you'll uncover nuanced perspectives that enhance understanding of Canada's diverse social issues, ensuring ethical, impactful research. This slide transitions to quantitative data analysis, where we'll explore statistical methods. Following qualitative data analysis, let's explore quantitative data analysis in Canada's research context. Quantitative data analysis uses statistical tests, like t-tests or ANOVA, and models, like regression or factor analysis, to interpret numerical data. For example, a Canadian health study might use regression to predict obesity rates based on diet and exercise. Interpreting numerical trends and significance involves analyzing results, like p-values, to determine if findings, such as the effect of a fitness program, are statistically meaningful. Ensuring accurate, unbiased results requires robust statistical methods, like checking assumptions for normality, and transparent reporting to avoid data manipulation. Ethical considerations include clear documentation of analysis procedures, ensuring participant anonymity, and avoiding selected reporting to maintain credibility. Quantitative data analysis aligns with course objectives by enabling you to derive reliable, generalizable findings for fields like epidemiology or economics, supporting evidence-based decisions in Canada's research landscape. By mastering these techniques, you'll produce precise, actionable insights that address societal challenges, enhancing policy and practice with integrity. This slide transitions to descriptive statistics, where we'll explore summarizing data. Following quantitative data analysis, let's discuss descriptive statistics in Canada's research context. Descriptive statistics summarize data using measures like mean, median, mode, and standard deviation to provide an overview of trends. For example, a Canadian education study might report the average test scores, mean and variability, standard deviation across schools. These measures help researchers understand central tendencies in dispersion, such as median income in a socioeconomic study. Providing clear, visual representations, like histograms or box plots, enhances interpretation, such as visualizing health outcomes across Canadian provinces. Ethical considerations include accurate reporting to avoid misrepresentation, ensuring transparency in calculations, and using visuals that are accessible to diverse audiences. Descriptive statistics align with course objectives by enabling you to summarize data effectively for fields like public health or sociology, laying the foundation for further analysis. By mastering descriptive statistics, you'll present clear, reliable summaries that inform stakeholders and guide evidence-based decisions in Canada's research landscape, ensuring clarity and integrity. This slide transitions to inferential statistics, where we'll explore drawing conclusions. Following descriptive statistics, let's explore inferential statistics in Canada's research context. Inferential statistics allow researchers to draw conclusions about populations based on sample data, using tests like t-tests, ANOVA, or regression. For example, a Canadian health study might use a t-test to compare cholesterol levels between two groups, inferring population differences. ANOVA could analyze variance in fitness outcomes across multiple Canadian regions, while regression might predict hospital readmissions based on patient variables. Assessing statistical significance, such as p-values below 0.05, determines if results are meaningful, ensuring robust conclusions. Ethical considerations include transparent reporting of test assumptions, avoiding p-hacking, and ensuring participant anonymity to maintain trust. Inferential statistics align with course objectives by enabling you to make generalizable claims for fields like epidemiology or education, supporting evidence-based policies in Canada. By mastering these methods, you'll derive actionable insights from sample data, addressing societal challenges with precision and ethical integrity, enhancing research impact. This slide transitions to t-tests, where we'll explore a specific statistical method. Following inferential statistics, let's discuss t-tests in Canada's research context. T-tests compare means between two groups to determine if differences are statistically significant, commonly used in quantitative studies. For example, a Canadian public health study might use an independent t-test to compare average blood pressure between men and women. Paired t-tests are used for related samples, like measuring fitness levels before and after a Canadian exercise program. Ensuring assumptions, such as normality and equal variances, is critical for valid results, requiring checks like Shapiro-Wilk tests. Ethical considerations include transparent reporting of assumptions, avoiding data manipulation, and ensuring participant anonymity to maintain credibility. T-tests align with course objectives by enabling you to analyze group differences rigorously for fields like health sciences or psychology, producing reliable findings. By mastering t-tests, you'll contribute to evidence-based insights, such as evaluating intervention effectiveness, that inform policy and practice in Canada's research landscape, ensuring precision and ethical integrity. This slide transitions to ANOVA, where we'll explore multi-group comparisons. Following t-tests, let's explore ANOVA in Canada's research context. Analysis of variance. ANOVA compares means across multiple groups to identify significant differences, ideal for complex studies. For example, a Canadian education study might use one-way ANOVA to compare test scores across 3 teaching methods. Two-way ANOVA could analyze effects of teaching method and student age on performance, capturing interaction effects. Checking assumptions, like normality and homogeneity of variances, ensures valid results, using tests like Lebanese for variance equality. Ethical considerations include transparent reporting of methods, avoiding selected reporting, and ensuring participant anonymity to maintain trust. ANOVA aligns with course objectives by enabling you to analyze multi-group data for fields like psychology or public health, producing generalizable findings. By mastering ANOVA, you'll derive insights into group differences, such as evaluating healthcare interventions across Canadian regions, informing evidence-based policies with precision and integrity. This slide transitions to regression analysis, where we'll explore predictive modeling. Following ANOVA, let's discuss regression analysis in Canada's research context. Regression analysis predicts outcomes using independent variables, modeling relationships between factors. For example, a Canadian health study might use linear regression to predict blood sugar levels based on diet and exercise. Logistic regression could predict binary outcomes, like the likelihood of hospital readmission based on patient age. Ensuring model fit and validity involves checking assumptions, like linearity or multicollinearity, and using metrics like R-squared to assess accuracy. Ethical considerations include transparent reporting of model limitations, avoiding overfitted models, and ensuring participant anonymity in datasets. Regression analysis aligns with course objectives by enabling you to model complex relationships for fields like epidemiology or economics, producing actionable insights. By mastering regression, you'll predict trends, such as healthcare outcomes in Canada, informing evidence-based interventions in policies with precision and ethical integrity, enhancing research impact. This slide transitions to correlation analysis, where we'll explore variable relationships. Following regression analysis, let's explore correlation analysis in Canada's research context. Correlation analysis measures relationships between variables, assessing their strength and direction without implying causation. For example, a Canadian study might use Pearson correlation to examine the relationship between exercise frequency and heart rate, assuming normal data. Spearman correlation is used for non-parametric data, like ranking patient satisfaction and hospital wait times. Interpreting strength, e.g., correlation coefficient of 0.8 indicating strong positive and direction, positive or negative, provides insights into variable associations. Ethical considerations include avoiding misinterpretation of correlation as causation, transparent reporting, and ensuring participant anonymity. Correlation analysis aligns with course objectives by enabling you to identify variable relationships for fields like public health or sociology, laying the groundwork for further analysis. By mastering correlation, you'll uncover patterns, such as health behavior trends in Canada, informing research design and policy with precision and integrity. This slide transitions to mixed methods research, where we'll explore integrated approaches. Following correlation analysis, let's discuss mixed methods research in Canada's research landscape. Mixed methods research combines qualitative and quantitative approaches to provide comprehensive insights into complex phenomena. For example, a Canadian study on workplace wellness might use surveys to quantify stress levels, quantitative, and interviews to explore employee experiences, qualitative. This approach enhances understanding by integrating numerical trends with contextual narratives, such as combining health outcome data with patient stories. Aligning methods with research goals involves selecting designs, like convergent or sequential, to address questions effectively, such as evaluating a health program's impact. Ethical considerations include transparent reporting of integration methods, ensuring participant consent for both data types, and respecting diverse perspectives. Mixed methods research aligns with course objectives by enabling you to design holistic studies for fields like education or public health, producing robust, actionable findings. By mastering mixed methods, you'll address Canada's societal challenges with nuance, evidence-based solutions, ensuring ethical integrity and research impact. This slide transitions to experimental designs, where we'll explore controlled studies. Following mixed methods research, let's explore experimental designs in Canada's research context. Experimental designs test causal relationships by manipulating independent variables and measuring effects on dependent variables, often using randomized controlled trials, RCTs. For example, a Canadian health study might randomly assign patients to a new drug or placebo to test efficacy, ensuring randomization minimizes bias. Controlling for confounding variables, like age or lifestyle, involves careful design, such as matching groups or using statistical controls, to isolate the intervention's effect. Ethical considerations include informed consent, ensuring participant safety, and transparent reporting of methods to maintain trust. Experimental designs align with course objectives by enabling you to establish causality in fields like medicine or psychology, producing reliable, generalizable findings. By mastering experimental designs, you'll contribute to evidence-based interventions, such as improving healthcare outcomes in Canada, with precision and ethical integrity, ensuring research drives impactful solutions. This slide transitions to quasi-experimental designs, where we'll explore alternative approaches. Following experimental designs, let's discuss quasi-experimental designs in Canada's research context. Quasi-experimental designs study effects of interventions without full randomization, useful when randomization is impractical, like in school-based studies. For example, a Canadian education study might use a pre-post design to evaluate a teaching method's impact on student performance, comparing test scores before and after. Non-equivalent group designs compare intervention and control groups without random assignment, such as studying health outcomes in two similar communities. Addressing practical constraints, like ethical or logistical limits, ensures feasible yet rigorous research. Ethical considerations include transparent reporting of design limitations, ensuring participant consent, and avoiding harm. Quasi-experimental designs align with course objectives by enabling you to study causal effects in fields like education or public health, producing actionable findings under constraints. By mastering these designs, you'll address Canada's societal challenges with practical, evidence-based solutions, ensuring ethical integrity and research impact. This slide transitions to case study designs, where we'll explore in-depth analysis. Following quasi-experimental designs, let's explore case study designs in Canada's research context. Case study designs involve in-depth exploration of a single case, like a Canadian hospital, or multiple cases, like several community programs, using qualitative methods such as interviews or document analysis. For example, a study might examine a rural Canadian clinic's healthcare delivery to understand barriers to access. These designs provide contextual, detailed insights into complex phenomena, like cultural influences on mental health services, by integrating multiple data sources. Ethical considerations include ensuring participant confidentiality, obtaining informed consent, and respectfully representing case-specific perspectives, especially for marginalized communities. Case study designs align with course objectives by enabling you to uncover nuanced insights for fields like sociology or healthcare, informing targeted interventions. By mastering case studies, you'll generate rich, contextually grounded findings that address Canada's societal challenges, ensuring ethical integrity and impactful research that enhances community well-being. This slide transitions to ethnographic designs, where we'll explore cultural immersion. Following case study designs, let's discuss ethnographic designs in Canada's research context. Ethnographic designs study cultural or social groups through immersive methods like participant observation and interviews, capturing lived experiences in their natural context. For example, a Canadian researcher might observe Indigenous community practices to understand traditional healing methods, spending months engaging with participants. Interviews complement observations by capturing personal narratives, such as elders' perspectives on cultural preservation. These designs provide deep insights into social dynamics, like community resilience in urban Canadian settings. Ethical considerations include building trust with participants, ensuring informed consent, and respecting cultural protocols, particularly for Indigenous or marginalized groups. Ethnographic designs align with course objectives by enabling you to explore cultural phenomena in fields like anthropology or sociology, producing nuanced findings. By mastering ethnography, you'll uncover rich, contextual insights that inform culturally sensitive interventions and policies in Canada, ensuring ethical integrity and impactful research. This slide transitions to survey designs, where we'll explore structured data collection. Following ethnographic designs, let's explore survey designs in Canada's research context. Survey designs collect data using questionnaires to measure attitudes, behaviors, or characteristics, often in quantitative studies. For example, a Canadian public health study might survey smoking rates among youth using a cross-sectional design to capture data at one point. Longitudinal designs track changes over time, like surveying mental health trends annually. Ensuring reliable, valid instruments involves using tested scales, like Likert scales, and pilot testing to refine questions. Ethical considerations include participant anonymity, informed consent, and avoiding coercive questions, ensuring trust. Survey designs align with course objectives by enabling you to gather scalable data for fields like epidemiology or sociology, producing generalizable findings. By mastering survey designs, you'll collect robust data on Canada's societal trends, informing evidence-based policies and interventions with precision and ethical integrity, enhancing research impact. This slide transitions to real-life applications, where we'll explore practical uses. Following survey designs, let's examine real-life applications of research designs and statistical analyses in Canada's context. These methods are applied in fields like health, studying disease prevalence through clinical trials, or education, evaluating teaching methods via surveys. For example, a Canadian health study might combine quantitative surveys on exercise habits with qualitative interviews on barriers to fitness, addressing societal challenges like obesity. In education, longitudinal surveys might track student outcomes to inform policy. Combining qualitative and quantitative insights provides holistic understanding, such as integrating patient data with narratives to improve healthcare access. Ethical considerations include ensuring participant consent, transparent reporting, and equitable representation of diverse groups, like Indigenous communities. These applications align with course objectives by demonstrating how research designs drive evidence-based solutions in Canada's research landscape. By applying these methods, you'll address societal challenges with rigorous, impactful findings, ensuring ethical integrity and enhancing community well-being. This slide transitions to health research applications, where we'll explore specific examples. Following real-life applications, let's explore health research applications in Canada's context. Health research uses designs like clinical trials to study disease prevalence or test interventions, such as a Canadian trial evaluating a new diabetes drug. Surveys might quantify health behaviors, like vaccination rates, while qualitative methods, like focus groups, explore patient experiences with healthcare access. These approaches address public health challenges, such as mental health stigma or chronic disease management. Ensuring ethical participant treatment involves informed consent, confidentiality, and avoiding harm, particularly for vulnerable populations like seniors. For example, a study on Indigenous health might prioritize cultural sensitivity in recruitment. These applications align with course objectives by enabling you to design rigorous health studies that produce actionable, evidence-based findings for Canada's healthcare system. By applying these methods, you'll contribute to policies and interventions that improve health outcomes, ensuring ethical integrity and impactful research that addresses Canada's public health needs. This slide transitions to education research applications, where we'll explore learning-focused studies. Following health research, let's discuss education research applications in Canada's context. Education research evaluates teaching methods or student outcomes using designs like longitudinal surveys to track academic progress over years, such as assessing literacy programs in Canadian schools. Case studies might explore classroom dynamics in diverse settings, like urban versus rural schools, to understand teaching effectiveness. These approaches address challenges like educational equity, ensuring all students, including Indigenous or low-income groups, have access to quality learning. Ethical considerations include participant consent, protecting student privacy, and ensuring inclusive representation in study designs. For example, a study might use purposive sampling to include marginalized voices. Education research aligns with course objectives by enabling you to design studies that inform evidence-based educational policies in Canada, fostering equitable outcomes. By applying these methods, you'll generate insights that improve teaching practices and student success, ensuring ethical integrity and impactful research for Canada's diverse education system. This slide transitions to example research designs, where we'll explore practical cases. Following education research, let's explore an example research design, a clinical trial in Canada's health research context. A randomized controlled trial, RCT, tests drug efficacy, such as a Canadian study evaluating a new heart medication. Participants are randomized into treatment and placebo groups to minimize bias, with variables like age or health status controlled through matching or statistical adjustments. Outcomes, like recovery rates or side effects, are measured using standardized metrics, such as blood pressure readings. Ethical considerations include informed consent, ensuring participant safety, and transparent reporting of adverse effects to maintain trust. This design aligns with course objectives by demonstrating how rigorous experimental methods produce reliable, generalizable findings for healthcare. By mastering clinical trial designs, you'll contribute to evidence-based medical advancements in Canada, addressing health challenges with precision and ethical integrity, ensuring impactful research that improves patient outcomes. This slide transitions to another example, a case study design, where we'll explore qualitative applications. Following the clinical trial example, let's explore a case study design in Canada's research context. This design might examine a community health program, like a Canadian initiative promoting mental wellness in rural areas. Using interviews with participants and staff, and document analysis of program records, researchers gather in-depth data on implementation and impact. For example, interviews might reveal barriers to access, while records show participation rates, providing contextual insights into program effectiveness. Ethical considerations include ensuring participant confidentiality, obtaining informed consent, and respectfully representing community voices, especially for marginalized groups. This design aligns with course objectives by demonstrating how qualitative methods produce nuanced findings for fields like public health or sociology. By mastering case study designs, you'll uncover detailed insights that inform targeted interventions, such as improving rural healthcare in Canada, ensuring ethical integrity and impactful research that enhances community well-being. This slide transitions to a survey design example, where we'll explore quantitative applications. Following the case study example, let's explore a survey design in Canada's research context. This design might study public health trends, like vaccination attitudes among Canadian adults, using a cross-sectional survey to collect data at one time point. Questionnaires with validated scales, such as Likert items on trust in vaccines, ensure reliable, consistent responses. Pilot testing refines questions to avoid bias, like leading phrasing. Ethical considerations include participant anonymity, informed consent, and ensuring inclusive sampling to represent diverse groups, such as urban and rural populations. This design aligns with course objectives by demonstrating how quantitative surveys produce generalizable findings for public health or sociology. By mastering survey designs, you'll generate robust data that inform evidence-based policies, such as vaccination campaigns in Canada, ensuring ethical integrity and impactful research that addresses societal health challenges with precision. This slide transitions to best practices in research design, where we'll explore strategies for rigor. Following the survey example, let's discuss best practices in research design for Canada's research landscape. Ensuring validity means designing studies that measure intended constructs, like using validated scales in health surveys, while reliability ensures consistent results, such as repeatable experiments. Aligning methods with research questions involves selecting appropriate designs, like RCTs for causal questions or case studies for exploratory ones, to address issues like educational equity. Prioritizing ethical participant treatment includes obtaining informed consent, ensuring confidentiality, and respecting diverse perspectives, particularly for Indigenous or marginalized groups. For example, a Canadian study might use community consultation to design culturally sensitive research. These practices align with course objectives by fostering rigorous, ethical study designs that produce credible findings for fields like health or education. By adopting best practices, you'll ensure your research addresses Canada's societal challenges with precision, integrity, and impact, enhancing evidence-based solutions. This slide transitions to best practices in statistical analysis, where we'll explore analytical rigor. Following research design practices, let's explore best practices in statistical analysis for Canada's research context. Using appropriate statistical tests involves selecting methods, like t-tests for comparing two groups or regression for predictive modeling, that align with data types and research questions. For example, a Canadian health study might use ANOVA to compare treatment outcomes across regions. Ensuring transparent reporting means documenting assumptions, like normality, and results, like p-values, to maintain credibility. Avoiding data manipulation or bias, such as p-hacking or selected reporting, ensures findings are trustworthy. Ethical considerations include clear communication of limitations, protecting participant anonymity, and ensuring accessible reporting for diverse audiences. These practices align with course objectives by fostering rigorous, ethical analysis for fields like epidemiology or sociology, producing reliable findings. By mastering statistical best practices, you'll generate actionable insights that inform Canada's evidence-based policies, ensuring integrity and impact and addressing societal challenges. This slide transitions to recommendations for research design, where we'll explore actionable strategies. Following statistical best practices, let's provide recommendations for research design in Canada's context. Selecting designs for specific objectives involves choosing methods, like experimental designs for causal questions or ethnographic designs for cultural studies, to address research goals effectively. For example, a Canadian health study might use an RCT to test interventions. Integrating mixed methods approaches combines qualitative and quantitative data, like surveys and interviews, to provide holistic insights into issues like mental health access. Engaging stakeholders, such as community leaders or policymakers, in planning ensures research aligns with real-world needs, like consulting Indigenous groups for health studies. Ethical considerations include transparent design processes, ensuring participant consent, and prioritizing inclusive representation. These recommendations align with course objectives by fostering rigorous, relevant study designs that produce impactful findings for fields like public health or education. By implementing these strategies, you'll address Canada's societal challenges with ethical, evidence-based research, enhancing community well-being. This slide transitions to recommendations for statistical analysis, where we'll explore analytical strategies. Following research design recommendations, let's provide recommendations for statistical analysis in Canada's research context. Choosing robust statistical models involves selecting appropriate tests, like regression for predictive studies or ANOVA for multi-group comparisons, to match data and objectives. For example, a Canadian education study might use logistic regression to predict student outcomes. Validating assumptions rigorously, such as checking normality or equal variances, ensures reliable results. Using tests like Shapiro-Wilk, using software, like R or SPSS, enhances accuracy in calculations and visualizations, streamlining complex analyses like factor analysis. Ethical considerations include transparent reporting of methods, avoiding data manipulation, and ensuring accessible outputs for diverse audiences. These recommendations align with course objectives by fostering precise, ethical analysis for fields like epidemiology or sociology, producing credible findings. By mastering these strategies, you'll generate actionable insights that inform evidence-based policies in Canada, ensuring integrity and impact and addressing societal challenges. This slide transitions to ethical considerations, where we'll explore research integrity. Following statistical recommendations, let's discuss ethical considerations in Canada's research landscape. Ensuring informed consent involves clearly explaining study purposes and risks to participants, like in a Canadian health trial, while confidentiality protects their data, such as anonymizing survey responses. Prioritizing participant safety and fairness means avoiding harm, like ensuring safe interventions in clinical studies, and equitable representation, particularly for marginalized groups like Indigenous communities. Complying with Canadian research guidelines, such as Tree Council Policy Statement (TCPS2), ensures ethical conduct, like respecting cultural protocols in Indigenous research. Ethical considerations also include transparent reporting and avoiding conflicts of interest to maintain trust. These principles align with course objectives by fostering responsible, credible research that produces impactful findings for fields like health or sociology. By prioritizing ethics, you'll build trustworthy studies that address Canada's societal challenges with integrity, enhancing community well-being and research credibility. This slide transitions to evaluating research success, where we'll explore assessment methods. Following ethical considerations, let's explore evaluating research success in Canada's context. Measuring validity ensures studies accurately address research questions, like using validated scales in health surveys, while reliability confirms consistent results, such as repeatable experiments. Assessing impact on knowledge and policy involves evaluating how findings, like those from a Canadian education study, inform teaching practices or health policies. Using feedback from stakeholders, like participants or policymakers, refines methods, such as adjusting survey designs based on pilot results. Ethical considerations include transparent reporting of limitations, avoiding inflated claims, and ensuring inclusive feedback processes, particularly for diverse communities. Evaluating success aligns with course objectives by ensuring data-driven, impactful research for fields like public health or education. By mastering evaluation, you'll assess your study's contributions to Canada's knowledge base, ensuring ethical, evidence-based solutions that enhance societal well-being and research integrity. This slide transitions to summary, where we'll consolidate key points as we conclude our lecture on research designs and statistical analyses in Canada's context. Let's summarize key points. Research designs provide structured plans for rigorous studies, using qualitative methods, like interviews, for contextual insights, and quantitative methods, like surveys, for generalizable findings. Sampling techniques, such as random or purposive, ensure representative data, while statistical analyses, like t-tests or regression, interpret trends accurately. Applications in health and education, like clinical trials or case studies, address societal challenges, such as healthcare access or educational equity. Examples, like RCTs or ethnographic designs, illustrate practical implementation. Best practices, like ensuring validity, and recommendations, like mixed methods approaches, foster robust research. Ethical considerations, including informed consent and confidentiality, build trust. These align with course objectives to equip you with skills for designing and analyzing studies that drive evidence-based solutions in Canada's research landscape, enhancing societal well-being with precision and integrity. Thank you for your engagement. Following our summary, this slide provides references for research designs and statistical analyses in Canada's context. Qualitative Inquiry and Research Design by Cresswell and Puth, 2024 offers frameworks for qualitative and mixed methods research, applicable to fields like sociology. Discovering Statistics Using R by Field, 2023 provides comprehensive guidance on statistical analysis, relevant for quantitative studies in health or education. The Tree Council Policy Statement, 2022 outlines ethical guidelines, ensuring compliance in Canadian research. Course notes by Piivand Pirouzi, Ph.D. complement these sources, offering practical insights tailored to designing rigorous, ethical studies. These references provide a strong foundation for conducting impactful research, aligning with course objectives to foster evidence-based solutions that address Canada's societal challenges with integrity and precision.